Longtime union organizer. How about a big hand for Thomas Walsh?
Thank you, Rick. Looking around, I know that most, if not all of us, know that even with a broken healthcare system in this country, it's labor unions that have been fighting through the years and winning affordable health insurance, access to quality healthcare for our members. And at the forefront of that movement is our honoree, Dolores Huerta. She has been doing that for well over 50 years. But most importantly, not only did she do it then, she continues to be at the forefront today. And it's not just our union. I think she's been there for all the unions that are fighting this very important issue. She's a living legend. She inspires all of us. Please join me. It's my great honor in welcoming Dolores Huerta.
And we'd like to give you this, Dolores, on behalf of the Labor United for Universal Health Care. And this says unity and solidarity. You've seen it before, undoubtedly. but Dolores epitomizes these words, unity and solidarity, and knows that without that, we do not have the power, and with that, we do have the power. Dolores Huerta.
Thank you. Thank you very much. Thank you. That's a very nice birthday present. Thank you. Thank you very much, Rick. He and his partner are going to be here to celebrate my 80th birthday at the Greek Theater. And that's going to be next Friday. It's going to be at 8 p.m. and we're going to have, from 5 to 7, we're going to be having all of the different movements. We've got to bring our movements together. When we talk about healthcare, and we know we didn't get the public option that we all were trying to get, right? But I always tell people that we had 200,000 people in Washington marching for immigrants' rights. The same day that they're voting on healthcare, you know? I remember when they had the big peace march, and we had the green march. You know, we had 500,000 to 700,000 people there in Washington. What was going on? The next Monday, the confirmation of Judge Roberts. You know what I mean? And I would say, let's get some people to go over to the Senate. You know, of all of those people there, we could have probably stopped that nomination. And so we've got our immigrant rights right now. As you know, we now have Senator John Kyle from Arizona and McCain saying let's revisit the 14th Amendment, which means that people who are born in the United States, if their parents are not citizens, they can't be citizens. And of course they did this so that Native Americans and African Americans could become citizens of the United States, which kind of means, okay, let's take all of those Latinos and put them back into slave status, right? Right. Put them back into slave status, and we all know what's going on there, and it's so ugly that they are trying to, what they're trying to do to our Latino community. But we know it's not going to stop, and it's not going to, all of this right-wing rhetoric, and now with the Supreme Court decision, you know, the corporations can give all the money that they want for political campaigns, which means that our side, the progressive side, is going to make it harder and harder for us to really get our agenda, to make our agenda a reality. And so I think that one way we can do it is by, let's all come together, all of our movements, right? All of our movements, and we are the majority. We are the majority, but we've got to come and work together to make it happen. We could not just be in our own little silos, you know, with our own little causes. We've got to support each other and defend each other to make this happen. And the message is the same: organize, organize, organize. You know, like we did on the Great Boycott, right? Remember that? When we brought everybody together to boycott grapes, and we had how many, 17 million Americans that stopped eating grapes? Well, we've kind of followed that same strategy to make sure that we can all come together, and so that we can get the kind of health care that we need, right? Maybe not the kind that we're going to settle for right now, which was all that we could get at this point, but definitely we know that we have to keep working until we can, every labor union and every worker can have adequate health care. And it's, as we all know, and I know all of you in the room know this, but I'm just going to repeat it, that, you know, it's a shame and some kind of a sin when the United States of America is the only developed country in the world that does not have universal health care, right? I mean, that is a crime and a shame, and we have to keep repeating that because it's just amazing how many people in this last healthcare debate were so confused. Were so confused by the media that they didn't even want to pick up the phone and call their congressperson. And so we saw, how difficult that was to get even what we did get. Passed through the U.S. Congress. And so we just have so much work to do, and I want to thank everybody that's been doing this. So many of us, I was just talking to Ida back there, and she was reminding me when we were on those picket lines down the produce market, remember getting them to stop shipping the grapes, and we had people coming out with their, little dollies, and they were hitting us in the shins. And I was just telling her daughter, I was out there jeopardizing your mom's life out there, But, we did all that, and we were able to get the people to know about the farm workers and to get them to stop eating grapes. But I think, if anything else, if we can come out of this with, having people get recommitted, because we do have a lot of people that want to come together, want to organize, but people are kind of disillusioned, right? And they kind of getting kind of cynical, and we know that that's death when people get cynical, and they just don't feel motivated. And we know that this next election is absolutely critical. When we hear the statistics, and when I heard this statistic, it horrified me that our Democrats are only 1 point above the Republicans. Isn't that scary? What kind of people we're going to end up with running our government. It's been bad enough, for the last 8 years, and then to know that it's going to get even worse. So we know that we have a lot of work to do. And my foundation, by the way, if we do have any profits, we'll go to the Dolores Huerta Foundation for Community Organizing. And what my foundation does is that we raise money, we hire organizers, and we train them. And every organizer has to meet with 200 people in their homes. And then the message is, you have power. You have power, but you have to take responsibility. And you have to work with other people. And the message is, and I know everybody in this room knows this, I'm speaking to the choir, but I'm just telling you what we have to convince other people to do, that nobody is going to make the changes for us. We are the only ones that are going to do it. And we have to really believe that in our hearts. And I think our histories have shown of our activism that we can make those changes, but we know that it takes a lot of commitment and patience and time and dedication to make it happen. But we can make it happen. We can make it happen. We can see se puede it, right? We can see se puede it. And, so that's our message to everybody. And I want to thank all of you for working so long on healthcare. You've been out there, you were out there in front of everybody else. I know that here in California, we were able to pass the single-payer bill a couple of times, Sheila Kuhl's bill and then Mark Leno's bill. And I think we can make it happen again, but we just have to keep on working and not give up. And Cesar Chavez, who I worked with for so many years, and I love to quote Caesar because he always said things in a few short words, and that meant so much. And one of the things that he always said is, we will always win if we don't give up. As long as we don't quit, we will win. And a lot of us have been there for many, many years, like myself, organizing since I was 25, and, celebrated my 80th birthday on April the 10th, by the way, which is the day they killed Zapata, Emiliano Zapata, and the same day that Phil Burton died. Some of you that are my age will remember the great Phil Burton. He also died on my real birthday, April the 10th. So anyway, we're going to keep on working with you, and in all of our organizing that we do put an issue of health. I have to say this, in the Latino community, when our organizers would meet with all these hundreds of people that they meet with, by the way, we're now in 6 different communities in the Central Valley. And as we get more money and hire more organizers, we're going to come down to LA and come down to the other areas that we need to go to. But whenever we ask people what the major issue that they had, healthcare was always number 1. Education was number 2. Immigration was number 3. I do have to say that today, immigration has jumped to number 1 in the Latino community because of all the stuff that's been going on in Arizona. But healthcare is still a very, very vital issue, and we're going to keep working on it. We need to really, really concentrate on getting good people in. And some of you have to think of running for office, all right? I'm serious. Some of you have to think of running for office because we've got to get people that are going to support labor unions and women's rights and gay rights and the environmental rights, right? We've got to get people to do that. So I want to thank you for being here. Keep supporting this great organization. Let's all keep working together. Universal health care for all Californians. Si se puede.